Slovakia Chronicles, a podcast of information, news and much more of our beloved Slovakia. By Andrea Paolo Mazzucchetti. It's me! Let's start. Hello everyone to the 33rd episode of the Slovakia Chronicles Podcast. Christmas is coming and also the weather is helping us to be in a Christmas mood, but of course not all in a good way. In fact, in the capital, the snow and freezing rainfalls cause a lot of delays and accidents on the streets. The city borough located in the hills especially had more problems, such as Cramare and Diedeli, with delays in all the public transportation direction. People in Bratislava can report road and pavement that are not maintained at the hotline +421 259 356 777 or via email to zima@bratislava.sk. The line will work during the bad weather, such as snow and ice, between 7 and 19. The snow should change to rain, but the Slovak Hydrometeorological Institute issued a warning against black ice in the next few days, so be careful on the streets. Definitely the bad weather is not our worst enemy at the moment, and it seems that COVID in Slovakia is far to be defeated. In fact, the nationwide testing was probably not as effective as a nuclear weapon as the Prime Minister Igor Matovic had hoped. 2 weeks later, it also seemed that Health Minister Marek Krajci was too optimistic when he predicted the testing could flatten the curve of people infected with the coronavirus. Experts and hospital staff warned that the virus is becoming stronger again, which is reflected mostly in the number of hospitalized patients. Some experts say that if Slovakia wants to contain the virus, it needs to impose a lockdown. Otherwise, we may have to spend Christmas in a very limited regime. Bratislava region reports higher number, although it has belonged to the green region with a low COVID-19 incidence in the past few months. One reason for the increase might be the 19 September demonstration in the capital. Another reason could be that the people from the district of Trnava and Dunajska Streda, where the COVID-19 incidence is higher, are commuting to Bratislava every day. The increase in new coronavirus cases in Bratislava region has also been confirmed by the rising number of COVID-19 patients in the local hospitals. The number of hospitalized patients is also increasing in the Luis Pasteur University Hospital in Kosice, the Roosevelt Hospital in Baška Bystrica, the Faculty Hospital in Zdilina and the Faculty Hospital in Trenčín. One reason for the surge in new daily cases might be the irresponsible behavior of people who don't follow the anti-pandemic measures. The country now has only two options. One is to adopt the stricter measure before Christmas so it is possible to spend the holiday in a more relaxed regime. And the second option is to adopt the current measures and Christmas will be more limited. But if we really want to reduce the number of newly infected cases, we have no other option than a lockdown, according to the experts. Taking into account the current situation and the prospect in the short term, the committee decided not to reopen their schools, as planned on Monday 7 December. The Crisis Committee rejected the proposal submitted by the Education Ministry, who had already wanted to bring students back to school in early December, but it will not possible to test all pupils, their parents and teachers. Given the long period of closure, while the pupils follow distance learning programs, the minister admits that to catch up the summer holidays could be shortened, and, in the meantime, completely cancel the semester and spring holidays. Since the start of COVID-19 outbreaks around the world, early in this year, experts and the public alike have been urgently following the development of the vaccine that could put an end to the pandemic. The UK this week became the first country in the Western world to give the green light for the use of a COVID vaccine. Other countries, including Slovakia, are now drawing up plans to vaccinate their own population. But while some people in Britain are due to get their first doses within days, most Slovaks could be waiting well into next year before a vaccine is available for them. Slovakia will receive vaccine doses as part of 400 million vaccination ordered by the European countries. But this can only be released once the vaccine has been reviewed by the European Medicines Agency and then approval for the use is given by the European Commission. The EMA is not expected to give its approval for the Pfizer-BioNTech vaccine until November 29 at the earliest. Meanwhile, another from US firm Moderna is unlikely to get approval before January 12 according to the State Institution of Drug Control. These dates could be changed, however. The government has said that it is already drawing up plans to roll out vaccine once the approval comes. Once the vaccine doses are in Slovakia, authorities want to vaccinate up to 100 of people per day. Under a pandemic plan approved by the government in August, a priority was set to vaccinate 60-70% of the population so as to achieve herd immunity. Priority vaccination categories have also been set out. The first vaccine will be given to healthcare workers and other staff at healthcare facilities, followed by frontline workers such as police officers, firefighters, and those in critical infrastructures, as well as those considered most vulnerable, such as over 65s in care homes. After that, vaccines will be available to all the elderly people and others with serious disease, and then, finally, for the rest of the population. 2 separate doses are required. Experts estimate it could be in March or April, at the earliest, before vaccines are rolled out to everybody. The government has said vaccination will be free and voluntary. But recent polls have suggested many Slovaks wouldn't be unwilling to get vaccinated, but the survey found that people who said they trust the government and scientific institutions were more willing to get vaccinated. The government pandemic plan includes a recognition of the needs for a mass campaign to encourage vaccination among the population. Besides all the measures put in place by the actual government, another poll showed that over 60% of Slovaks are not happy with the way the Prime Minister Igor Matović has handled the government during the pandemic period. In all this bad news, there is also something to celebrate. Slovakia recorded 58 new HIV cases in Slovak citizens and another 21 among foreigners in the first 10 months of 2020, a figure that placed the country among those in the European Union less affected by AIDS. A low incidence trend has been ongoing for several years, but which saw a slight increase in the number of cases. The greatest numbers of infection are found in Bratislava region. Most people infected with HIV live in the larger cities, and mainly in the capital. AIDS appeared around the world in 1981, and the first case in Slovakia was recorded in 1985. If you suspect a possible infection, you need to get tested for HIV as soon as possible, which is free. A test are offered by the National Reference Center for HIV/AIDS Prevention at the Slovak Medical University in Bratislava. For the Minister of Healthcare Marek Krajci, prevention is fundamental in the fight against the disease. So, prevention is always the key for all possible illness. So, take care of yourself and hear you next week, hopefully with better news. Thank you for being part of the Slovakia Chronicles family and stay safe.